inferior nuchal line, and inferiorly it is bounded by the line which passes at the level of the clavicle to the spinous process of the 7 cervical vertebra. Bifrontal plane, which passes at the level of the transverse processes of the cervical vertebra, neck is divided into anterior division and posterior division. Posterior division, where is located the muscles, and anterior division of the neck, which we see on the picture. It is anterior division, which includes the organs, vessels, and nerves, and also muscles are located on this area. Anterior division of the neck is subdivided into 3 regions. We have medial triangle of the neck, lateral triangle of the neck, and sterno-occlade mastoidose region. So, medial triangle of the neck is that area which is located medially to the sterno-occlade mastoidose muscle. This will be medial triangle. Lateral triangle is the triangle which is located laterally to the sterno-occlade mastoidose muscle and sterno-occlade mastoidose region, which corresponds to the location of the sterno-occlade mastoidose muscle. Medial triangle by hyoid bone, this is hyoid bone, is subdivided into suprahyoid region and infrahyoid region. So suprahyoid region, which is located above the hyoid bone, so it will be bounded superiorly by the line which passes at the level of the lower margin of the mandible. Inferiorly, it is bounded by the horizontal plane which passes at the level of the hyoid bone, and laterally, it will be bounded by anterior borders of sterno-occlade mastoidose muscle. Infrahyoid region is the region which is located below the hyoid bone, so it lies below the horizontal plane, which is located, passes at the level of the hyoid bone. Laterally, it is bounded by anterior borders of sterno-occlade mastoidose muscle. Each region consists of the little triangles, imaginational triangles, which includes different contents of the neck region. In suprahyoid region, we have 3 triangles. We have 2 submandibular triangle and 1 submental triangle, which is located below the chin. So this is submental triangle, and these are submandibular triangles. In infrahyoid region, we have 2 carotid triangles, and 2 omotracheal triangles. 2 omotracheal triangles, which is also called muscular triangle, and we have 2 carotid triangles. Lateral triangle of the neck includes on both sides 2 little triangles. We have 2 supraclavicular triangles, and this will be supraclavicular triangles on both sides, and 2 omotrapezius triangle. So before we explain the boundaries of these triangles, we must know which layers we have on the neck region. Superficial layers of the neck are skin, subcutaneous fat tissue. According to the Shevchenko scheme, neck is covered by five fascias. Five fascias, which are differently located on the neck region and makes compartment for the muscles and structures of the neck region differently. And between these fascias, except the content organs and vessels and nerves, between these fascias are located fat connective tissue spaces. Fat connective tissue spaces which are communicated to the other regions, fat connective tissue spaces. And these are ways of spreading of infection, inflammatory processes, if it is located in this layer, to other regions, fat connective tissue layer. Before we explain this fascias location on the neck, we must know which group of muscles we have on the neck region. On the neck, more superficially is located sternocleidomastoideus muscle, sternocleidomastoideus muscle, so which takes origin from the mastoid process, and it is attached to the sternal notch and also to the upper border of the clavicle. This is this muscle, sternocleidomastoideus muscle. Platysma muscle also is located superficially. Platysma is not shown on this picture, but it starts from the clavicle. We know, we have told this muscle, and it is inserted to the lower margin of the mandible. So it fibers passes on the face. And superficial group of the muscle also includes trapezius muscle. This is trapezius muscle. So more superficially on the neck is located which muscles? Is located sternocleidomastoideus muscle, trapezius muscle, and platysma muscle. Middle group of the muscles, which is located in the anterior part of the neck, below the hyoid bone, we have infrahyoid muscles. Infrahyoid muscles, which includes sternohyoid muscle, sternothyroid muscle, thyrohyoid muscle, and omohyoid muscles. These are superior bellies of omohyoid muscle, and these are inferior bellies of omohyoid muscle. So inferior belly of omohyoid muscle separates two lateral triangle from each other, supraclavicular triangle from omotrapezius triangle. We have also lateral group of the muscles. These are lateral group of the muscles. Lateral group of the muscle includes scalarior, medius, and posterior muscle, and deep group of the muscles, which is also called prevertebral muscles, which is located anteriorly to the vertebra, includes longus capitis muscle and longus colli muscle. Longus capitis and longus colli muscle. So, boundaries of these triangles, what we have told now, suprahyoid region. Look, in suprahyoid region, we have told we have what? Two submandibular triangles and one submental triangle. Yeah, submental triangle boundaries will be laterally anterior bellies of digastric muscle, and inferiorly it is bounded by hyoid bone. Floor of this triangle is formed by mylohyoid muscle. Mylohyoid muscle forms the floor of the oral cavity. These are mylohyoid muscle. Submandibular triangle boundaries will be lower margin of the mandible. Medially, it will be bounded by anterior belly of digastric muscle, and inferiorly, it will be bounded by posterior belly of the digastric muscle. Floor of this triangle is formed by mylohyoid muscle and also by hypoglossus muscle. This muscle, both muscle, forms the floor of the um, oral cavity. In infrahyoid region, we have what? Two carotid triangles, yeah, and omotracheal triangles. Carotid triangle boundaries will be superiorly posterior belly of digastric muscle. Inferiorly, it will be bounded by superior belly of omohyoid muscle, and posteriorly it will be bounded by anterior borders of sternocleidomastoideus muscle. Omotracheal triangle borders will be laterally by superior belly of omohyoid muscle and anterior border of sternocleidomastoideus muscle. Medially, deeply by trachea is bounded this triangle by midline of the neck. These two omotracheal triangles are communicated to each other, and deeply through the omotracheal triangle we have all the organs of the neck. So all organs of the neck region are located in the omotracheal triangle. Which organs? Trachea, esophagus, pharynx, larynx, thyroid gland are present in the omotracheal triangle. Carotid triangle includes main vessels and the nerves of the medial triangle of the neck. So main vessels and nerves of the medial triangle is located in the carotid triangle. And which are these main vessels and nerves? These main vessels and nerves are common carotid artery, internal jugular vein, and vagus nerve. So main vessels and the nerves of the medial triangle is present in the carotid triangle. Lateral triangle of the neck, we have told, includes what? Supraclavicular triangle and omotrapezius triangle. Supraclavicular triangle boundaries will be inferiorly clavicle, anteriorly and medially by posterior border of sternocleidomastoideus muscle, and superiorly it will be bounded by inferior belly of omohyoid muscle. Omotrapezius triangle boundaries will be inferiorly what? Inferior belly of omohyoid muscle, posteriorly trapezius muscle, and anteriorly and medially by posterior border of sternocleidomastoideus muscle. Same to the other side of the omotrapezius triangle. Main vessels and the nerves of the lateral triangle of the neck is present in the supraclavicular triangle. Supraclavicular triangle, which includes subclavian vein, subclavian artery, and brachial plexus. So main vessels and the nerves of the lateral triangle of the neck is present in the supraclavicular triangle. We have told that according to the Shevchenko's scheme, neck is covered by five fascias. So layers of the neck region. If we told first layer, we have what? Skin. Below the skin is located subcutaneous tissue. Below the subcutaneous tissue is located superficial fascia. On the picture you see now transverse section of these layers of the neck. So if we look on the neck in the transverse section, here on this picture is shown the fascia's location and how it makes compartment for the structures, what we have told on the neck region. So below subcutaneous tissue is located superficial fascia. Superficial fascia, which is first fascia of the neck, this yellow, what is shown on the picture. So it is superficial fascia of the neck, which is part of the superficial fascia of the body. So it is continuation of the superficial fascia of the face. It encloses the neck and it makes compartment for platysma muscle. So platysma muscle is located into the layers of the superficial fascia of the neck. So this fascia, first fascia is present in every triangle of the neck, what we have told. Second fascia is called proper fascia of the neck. Proper fascia of the neck, which is divided into superficial layer and deep layer. So second fascia of the neck will be what? Superficial layer of the proper fascia. Is this on the picture, this green, what is shown? Superficial layer of the proper fascia originates from the superior nuchal line of the occipital bone. To imagine on this picture, look, it originates from superior nuchal line of the occipital bone, descends downward, and when it reaches the trapezius muscle, it splits and make into two layers and makes compartment for platysma muscle. And after that, it becomes as one layer. When it reaches sternocleidomastoideus muscle, it also splits into two layers, makes compartment for sternocleidomastoideus muscle. Inferiorly, it is attached to the anterior surface of the clavicle and manubrium sterni. In the midline of the neck, it connects the white line of the neck. It passes above the hyoid bone, and so it is also present in the suprahyoid region, and in suprahyoid region, in submandibular triangle, it makes compartment for submandibular gland, which lies in submandibular triangle, and on the face, it continues to the proper fascia of the face. In transverse section, if we see of this fascia, look, so this is second fascia, superficial layer of proper fascia, which makes compartment for trapezius muscle. Then it becomes as one layer, as we have told. When it reaches the sternocleidomastoideus muscle, it makes sheet for sternocleidomastoideus muscle, but it also makes compartment of submandibular gland. In transverse section is not shown the gland. So second fascia of the face, superficial layer of the proper fascia, is also present in every triangle of the neck, told, and it makes compartments. So for trapezius muscle, sternocleidomastoideus muscle, and submandibular gland. Third fascia will be deep layer of the proper fascia. Deep layer of the proper fascia, to imagine on this picture, it extends from hyoid bones to the posterior surface of the clavicle and manubrium sterni. So it is attached inferiorly to the neck on the posterior surface of the clavicle and manubrium sterni, and laterally it is bounded by omohyoid muscles. On this level is located the deep layer of the proper fascia. So superiorly it is bounded by hyoid bone, laterally by omohyoid muscle, and inferiorly it is attached to the posterior surface of the clavicle and manubrium sterni. This fascia is described as trapezium-shaped fascia. Why trapezium shape? Because it is located on this level. And it makes compartment for infrahyoid muscles. Infrahyoid muscles, so which muscles? Which is located below the hyoid bone. These are sternohyoid muscle, sternothyroid muscle, thyrohyoid muscle, and omohyoid muscles. So, and this fascia is present where? This fascia is present only in omotracheal triangle, and also it is present in the supraclavicular triangle of the lateral triangle. In a transverse section, if we look at this fascia, and this is a deep layer of the proper fascia, deep layer of the proper fascia, which makes compartment for infrahyoid muscle. For fascia is called endocervical fascia. Endocervical fascia, which is divided into parietal layer and visceral layer. Parietal layer of the endocervical fascia is this on this picture. Look, this is parietal layer of the endocervical fascia. Parietal layer of the endocervical fascia makes compartment for main vessels and the nerves of the medial triangle of the neck. So it makes compartment for which vessels and nerves? For common carotid artery, internal jugular vein, and the vagus nerve, and also parietal layer of endocervical fascia lies that space where is located all the organs of the neck. So parietal layer of endocervical fascia lies the omotracheal triangle. So this fascia we have in carotid triangle, and we have in omotracheal triangle. Parietal layer of endocervical fascia is not present in lateral triangle of the neck, and also it is not present in suprahyoid region. Visceral layer of endocervical fascia will be this layer. Visceral layer of the endocervical fascia covers all the organs of the neck. All the organs of the neck, trachea, esophagus, thyroid gland is covered by visceral layer of the endocervical fascia. So this layer is present in omotracheal triangle only. So endocervical fascia's parietal layer we have where? in carotid triangle and in omotracheal triangle, visceral layer of the endocervical fascia we have in omotracheal triangle, where it covers all the organs of the neck. Fifth fascia is called prevertebral fascia. This will be prevertebral fascia, which is located anteriorly to the vertebra. It originates, look, from parietal layer of the endocervical fascia, and it makes sheath compartment for prevertebral muscles, which we have told longus capitis and longus coli muscle. Also, lateral group of the muscles, scalenus anterior, medius, and posterior muscle, and also fifth fascia, prevertebral fascia, makes sheet for main neurovascular bundle of the lateral triangle of the neck. So it covers which vessels and nerves? It covers subclavian vein, subclavian artery, and the brachial plexus brachialis. So prevertebral fascia we have where? The vertebral fascia we have in carotid triangle, we have in omotracheal triangle, and we have in lateral triangle of the neck, both in the supraclavicular triangle and in homotrapezius triangle. We have told that between these fascias is located fat connective tissue spaces. Which are communicated to the other regions, fat connective tissue spaces, and this communication are ways of the spreading of inflammatory process if it is located on the neck to other regions, fat connective tissue layer. And also to these layers, superficial fascial layer, where is located superficial veins. Superficial veins are present between superficial layer and deep layer of the proper fascia. Outer wall of these veins are closely connected to the fascial layer. This is clinically important. These are superficial veins of the neck. These are external jugular vein, and these are anterior jugular vein, which is located superficially. So between these layers, what we have told, and outer wall of these veins are closely connected to this fascia. Clinically, why it is important? When accidentally these veins are damaged during surgery, it must be immediately ligated because these veins can't be contracted. Damage of this vein may cause air embolism. So that's why if these veins are accidentally damaged during the surgery, it must be immediately ligated. So one of the complications during surgical intervention of the neck region is damage of the superficial vein. So if these veins are damaged during surgery, it must be immediately ligated, not to develop air embolism. We have told that between the fascias we have what? Fat connective tissue spaces. Which fat spaces we have between these fascias? Let's start from superficial. Between superficial layer of the proper fascia and deep layer of the proper fascia, between second and third fascia is located suprasternal space. Suprasternal space which lies above the sternal notch. We have told, if you remember, that we have second fascia is attached where to the anterior surface of the clavicle and manubrium sternum. Yeah. Third fascia is attached where to the posterior surface of the clavicle and manubrium sternum. So between these two layers is located suprasternal space. Suprasternal space, which includes jugular venous arch. This is jugular venous arch. Jugular venous arch, which connects two anterior jugular veins to each other. We have told that anterior jugular vein is one of the superficial veins of the neck, and this vein originates from submental triangle, which we have two on both sides of the midline of the neck. And these two anterior jugular veins are communicated to each other by this jugular venous arch. And this jugular venous arch is present in the suprasternal space. Suprasternal space. So if this vein accidentally is damaged during surgery, it must be what? Immediately ligated, and mostly it is maybe damaged during inferior tracheostomy operation. So when is done such type of the surgical intervention on the neck, the surgeon must know that in superficial layers here is located jugular venous arch, and if it is accidentally damaged, it must be immediately ligated. We also have previsceral fat space. Previsceral fat space. Previsceral fat space is located between visceral layer of the endocervical fascia and parietal layer of the endocervical fascia. Previsceral fat space includes organs, and also previsceral fat space down is communicated to the fat space of the anterior mediastinum. So this means clinically what? That if here in this space is located fat connective tissue, if in this layer, is located inflammatory process in previsceral fat space, it down may be spread it to the fat space of the anterior mediastinum. Or contra, if we have inflammatory process in the anterior mediastinum, it upward from thorax may be spread it to the previsceral fat space. That space which is located between visceral layer of the endocervical fascia and prevertebral fascia, it is called retrovisceral fat space. Retrovisceral fat space down is communicated to the fat space of the posterior mediastinum. So if during pathological processes here spreads inflammatory process in the retrovisceral fat space, it down may be spreading to the fat space of the posterior mediastinum. We have superficial fat space of the lateral triangle. Superficial fat space of the lateral triangle is located between second and fifth fascia of the neck. This fat space is communicated to the fat space of the scapular region. So this means clinically what? That if here we have something, it may be spreaded to the fat space of the scapular region. Also, we have prevertebral fat space. Prevertebral fat space is that space which is located between prevertebral muscles and prevertebral fascia. Prevertebral fat space of the neck down is communicated to the fat space of the thorax region. This means what? That here if spreads anything in the prevertebral face space of the neck, it may down spread it to the thorax, partly to the posterior mediastinum of the thorax region. Do we understand? Have you any question in this part, what we have told?
No, Professor.
Except fat spaces, which is located between the fascias, on the neck is present muscular spaces. And muscular spaces on the neck is located between scalenus muscles. We have three muscular spaces which is present between this scalenus muscle. We have scalenovertebral triangle, we have interscalenus space, and we have antescalenus space. Scalenovertebral triangle is the triangle which is located between scalenus anterior muscle and longus colli muscle, prevertebral muscle. On this picture, longus colli is not shown, but we know that it passes anteriorly to the vertebra, yeah? So, this triangle is located between scalenus anterior and longus colli muscle. Scalenovertebral triangle includes first part of the subclavian artery. The subclavian artery origin is from thorax. Yes, student, we have two subclavian arteries, what? Right and the left. Right comes from brachiocephalic trunk, left from arch of the aorta, from thorax region. Now this picture is shown right subclavian artery. So when it is ascends upward from thorax into the neck, it passes at first in the scalenovertebral triangle and then enters into interscalenus space. So interscalenus space is that space which is located between scalenus anterior and scalenus medius muscle. Interscalenus space includes subclavian artery and brachial plexus. So content of the interscalenus space is subclavian artery and brachial plexus. Brachial plexus, which is formed by C5 to T1 nerves. Antescalenus space is located anteriorly to the scalenus muscle. So it is bounded anteriorly by infrahyoid muscles, posteriorly by scalenus anterior muscle, and content of the antescalenus space is initial part of the common carotid arteries, vagus nerve, and phrenic nerve, which passes in these spaces. More details of this triangle we talk next lecture. Today we finish. So clinical anatomy of each triangle and its content we talk next lecture, student. We don't have time now. Have we any question? No question? No. So we finish today. We continue other portions next lecture.
Thank you, Professor.
Goodbye.